This is my 6th month of pregnancy, in which this is the next video of the week-by-week series in which I will discuss the chances in your baby in the 21st, 22nd, 23rd and 24th week of pregnancy. Changes in your body and what can be important tips for you for this time. I will show all that in this video, so do watch this video till the end. So let's talk about the 21st week of pregnancy. What changes happen in your baby in the 21st week? So as I explained in my previous videos, fat deposition starts in the baby's body. So now as the baby is growing up, as he enters the 21st week, his fat deposition will increase even more, so that he can keep his body warm. The internal organs of the baby are maturing. Gradually, all the organs inside his body from head to toe will mature and start their functions. The baby starts to chew. The buds which are necessary for the permanent teeth of the child develop at this time. The internal sex organs of the child develop. For example, if you have a boy, then his testicles develop. But they also remain inside the abdomen, they remain inside the stomach, the same is the case with females. At this time, the child can coordinate his hand and leg movements very well. He can control his movements. So, now at this time, his movements and kicks become stronger and you start feeling them better. If we talk about height, then the child becomes about 5 inches long by this time. And his weight is around 350 grams. The baby's eyebrows and eyelids are now formed. It develops and meconium starts being produced in the intestines of the baby. Meconium is the first stool of the baby which we call meconium. Now it starts forming in the intestines. By this time the taste buds of the baby also develop so that the water inside is amniotic fluid. It can test different types of tests in it. This was about the changes that occur in the baby. Now what changes can you expect in the mother's body at 21 weeks? So as I said, in the 21st week of pregnancy, you feel the movements of your baby more strongly. Your skin may get stretch marks due to dryness and stretching, and your belly almost reaches the level of your umbilicus, i.e. navel. So my tip for 21st week is that you should keep your body hydrated as much as possible. Drink plenty of water, or you can also focus on other liquids, apart from juices. Try to have 8 to 10 glasses of water in your stomach. The second important tip is that you should take a balanced diet. Patients start facing iron deficiency in a balanced diet. So that is why you can take iron-rich foods like spinach, apple, pomegranate, or any vegetables or fruits that become a little dark or black after coming in contact with air. You should know about them from these. It is possible that it has more iron. Try to include all these things in your diet. Apart from that, jaggery, gram and all these things also have good iron, so you can include them in your diet little by little in the form of a mixed diet. So my last tip is that if you have not started exercising yet, then contact your doctor. Or, if there is any yoga trainer near you who conducts exercises, you can start exercises. Or, yoga, meditation, anything. The more active the mother is during pregnancy, the healthier she is during pregnancy, the healthier the child is born, the more oxygen flow he gets. His brain development is also good. So that is why you have to pay proper attention to accessibility. So let us now talk about week 22 to 23 or 22 to 23 weeks. As I said, when the baby's movements become coordinated and strong, you start feeling the movements well. The baby now responds to external stimulation as well. Sometimes if music is playing or there is a loud sound, then also the baby's movements can be felt inside at the same time. So at this time you can try to keep yourself relaxed. You can listen to songs. You can sing songs for your baby or sing a lullaby to him. Or, you can talk to him because it is believed that by this time the ears of the baby are also developed. Plus he responds to external stimulation. So this is a good time when you can start building or establishing a bond with your baby. Fine hair starts appearing on the baby's body and also on the head. By this time, fine hair is called lanugo. So let's talk about the changes that come in the mother's body in 22 weeks of pregnancy. So you can feel that your skin starts becoming dry. You can see some melanin production or shadow on the body, especially on the face. Your central line, which we call linea nigra, also develops now. The central line above and below the navel in the middle of the body starts going down. So pigmentary changes come in the body, plus the skin remains dry. So it's due to this, patients often have itching problems. they have itching on the breast and stomach. Your belly grows a little more now, and the umbilicus, i.e. navel, and a little above it is also visible. If the growth of the child is good, then due to this you start having back pain in the lower part of the waist or in the back. There is swelling in the legs, or many times women have the problem of acidity. It is also very common. It is also very common to get leg cramps while sleeping at night. After 22 weeks of pregnancy, 23 weeks of pregnancy, my tip in pregnancy is that the more you keep your skin hydrated, the more moisturized it will be. The better it will be. You can apply moisturizer twice, thrice, or even 4 times a day. If it is winter season, try to apply moisturizer at least twice in summer too. And especially on the breast, you can apply a mixture of moisturizer and olive oil on your feet and abdomen at least 3 to 4 times a day for a minute each time, so that you do not develop stretch marks. You also have to keep a check on your weight gain. Sudden weight gain problem can occur in the entire pregnancy. Doctors advise, after the 5th month, the baby's weight increases and sudden weight gain occurs. Till now, only the baby's development was going on, organogenesis was going on, but now weight gain and growth are more, so because of that, your weight is also going to increase. For that, we will have to give up some unnecessary junk foods, sweets. Avoid all this and keep a healthy and balanced meal as much as possible. My last tip is that you have to develop the habit of sleeping on your side. You should sleep on the left lateral, preferably left. You should sleep on your side. The baby gets good blood flow, good oxygen, and his growth is also good. You have to avoid lying on your back. That is, you have to avoid sleeping straight. You can lie on your left side. You can use pregnancy pillows. You can keep a separate pillow between your legs, so that you have less discomfort and your sleep is undisturbed. So let's talk about 24 weeks of pregnancy. What changes come in the baby in the 24th week? So your baby now becomes almost the size of a pineapple. The baby starts making WBCs, i.e. white blood cells. White blood cells start forming in the body of the baby, due to which he can fight infections. As I said, the baby responds to loud sounds and can also feel touch sensations. The bones in the baby's ears develop further at this time so that the baby can hear with more accuracy. At this time, your baby starts practicing breathing movements and starts preparing himself, when he will have to breathe for the first time after delivery. His practice starts from now itself. Along with this, a fluid starts forming in the lungs, which we call surfactant, which helps in keeping the lungs inflated. Due to lack of surfactant in the baby, respiratory problems may occur, so that is why all the things that he will need after delivery, all those preparations start now. The facial features of the baby become better and his hair continues to grow. So let's talk about what changes come in mothers in 24 weeks of pregnancy. By the time you reach here, you start feeling strong movements of the child. Your belly starts appearing more prominently above the navel. By this time, your belly becomes as big as a football. Due to the growth of the child, you may see swelling in your legs. If you have to stand for a long time, then swelling in the legs is also visible a lot. Sometimes at this time, your doctor advises you to do a GCT test, i.e. sugar test for diabetes. Some of your routine tests like hemoglobin test are repeated again. Urine test can be repeated. If you have any complaint in the urine, then you have to get it done. Along with this time, you start feeling the frequency again, many times as if the child is growing and there is pressure on the uterus. Someone can complain about the frequency of urine bladder without infection. My tip for the 24th week is that if you have not visited your doctor in the recent 1 month, please visit him. And after 24 weeks, you have to get a diabetes test done. You must get it done. If sonography is needed, they will tell you. By the way, sonography is not done for everyone in these 24 weeks. You have to drink more water and take care of a balanced diet. If you have not started exercises yet and you do not have any complications, then you can ask your doctor and start exercising. So friends, this was my video on 5 months of pregnancy, in which I have tried to give you as much information as possible about the child for weeks 21, 22, 23, and 24 of pregnancy. I have tried to share all the important tips about the changes in your body during pregnancy and what other tips can be useful in this week in this video.